Hi, I'm Dr. John Raymond Baker, DC. I'm a chiropractic doctor in Texas, and I've been one for a lot of years, since 1989. Now, with most of my YouTube videos, I try to inform, entertain, or sometimes they just function as a vehicle for me to explore my angst or vent my anger about some topic, or to expose hypocrites. So today you might be lucky and see all three goals accomplished. I'm going to talk about different topics, and hopefully, keep my fingers crossed, I'll tie them all together. And I might be drinking coffee a little bit because my throat's dry. One of the serious problems we have in healthcare in the United States is pain management. The Texas, for example, has an Intractable Pain Act which urges doctors not to be afraid of over surveillance because they're giving out appropriate pain medications, but it gives with one hand and takes with the other, and makes the conditions under which opiates and similar drugs are prescribed onerous, to understate the situation. I'm going to be probably reading a little bit from this paper because I haven't memorized it. But I want to talk some also about not just pain control, but hospice, and also perhaps some of the hypocritical stances and actions of some hospice companies. And I draw a lot of these statistics and quotes from the National Hospice and Palliative Care Organization, also known as NHPCO, and also AmericanHospice.org. Both of these maintain websites about hospice and hospice issues, and I would say they're fairly authoritative. Now, what we're seeing with regard to hospice, and by the way, if you don't know what hospice is, people that are on the end stage of life, have terminal diseases, don't have much time left, who don't want to spend their days in the sterile environment of a hospital, often get put on hospice so that they can have nurses come in and take care of their needs, care for them, make sure their meds are up to date and all that, and make them more comfortable. And it's becoming a way that many patients have opted to go. And from looking at the statistics, one thing that we can see is year by year, 2009, 2010, 2011, the numbers of folks that are on hospice care, or on service as they like to call it, have increased. And in fact, in 2011, there was an estimated 1.65 million people on hospice care. This was up from 2010, up from 2009. What's also being seen is that even though there are more people on hospice, the time in service or on service is decreasing every year. The median 50th percentile length of service in 2010 was 19.7 days. That was a decrease from 21.1 days in 2009, and it's even less here in 2012. Now, this is from that information was from NHPCO. Now, this is from American Hospice, and I'm going to quote it, so please forgive me for reading. Quote, "If existing expert clinical guidelines for the management of pain were consistently followed, serious pain would be controlled acceptably 80 to 90% of the time. Yet pain remains undertreated. Studies have shown that among those suffering with cancer, significant pain occurs in 30 to 40% throughout the spectrum of the disease, and in 65 to 85% of people with advanced cancer." And I think those statistics are possibly low. Half of all serious children suffer pain, and 20% of them have moderate to severe pain. Parenthetically, it used to be, back in the early part of the 20th century, very rare to find a child with cancer. And now we're seeing a dramatic increase of children with cancer. Among elders living in a community, up to half suffer important pain problems, but this increases to 80% of elders who are living in a nursing home or other institution. 1/3 of the people with HIV disease live in the community, and nearly 2/3 of those in inpatient facilities. So the folks that are relegated to living in inpatient facilities tend to rate their pain as higher. Members of minority groups who are seriously ill fare even worse. Recent studies show that 50 to 80% of the time pain in these populations is not well managed. Also, and one of the issues that always gets thrown out, especially about opiates, which I believe are some of the best pain management tools, better than Neurontin and Lyrica, for the kind of pain that's normally being treated. Where was I? People, there's an issue of people always saying, "Oh, you'll get addicted." Here's something from AmericanHospice.org that tends to negate that assertion. Quote, "People who are prescribed opiates for the management of pain in accordance with generally accepted guidelines do not become addicted." Close quote. And even more interesting, in a study of over 11,000 patients who had had surgery and had post-operative surgical pain, that's 11,000 people, only 3 to 4 patients developed subsequent problems with substance abuse. This is much lower than the actual rate of substance abuse in the general population, which is around 8%. 8% would be a very low figure itself, but 3 to 4 individuals out of 11,000, that's incredible. So taking into account both of those, you can see that the addiction to opiates is far more blown out of proportion than in actuality. Also, it says that studies have actually shown that when pain is well controlled with appropriate use of pain medication, including opiates, people live longer than those with the exact same pain that is not well controlled. Now let me state that again in different words. It says that people who have their pain well controlled with opiates live longer than people with the same pain that's not well controlled. So length of life expectancy, lifespan increases with the proper use of opiates. And if you're a healthcare provider, that should be something that you'd be concerned with. How about driving under the influence of Vicodin, hydrocodone? There are 15 states in the United States that have what's called per se laws, per se drug driving laws. And basically, per se drug driving laws state that if you have certain drugs at any concentration in your bloodstream, you're considered impaired. Is Texas on the list? No. Is Louisiana on the list? No. Is New Mexico on the list? No. Is Arkansas on the list? No. What states are on the list? I want to read them to you. Arizona, Delaware, Georgia, Illinois, Iowa, Indiana, Michigan, Minnesota, Nevada, and Ohio, Pennsylvania, Rhode Island, Utah, Virginia, and Wisconsin. So most of the states that border Texas do not have per se laws, and it's fair to say that 15 out of 50, most states do not have per se drug driving laws. Now, people who have a lot of pain, whether it's from a bulging disc, herniated disc, some sort of neurological condition, cancer, any of a number of things, can be disabled because of their pain. Now, in their wisdom, one of the few good things that Congress has done was pass the Americans with Disability Acts. Now, a lot of people think that the ADA probably has somewhere in it a big long list of conditions, diseases that would cause you to be considered disabled. That's not the case. Actually, there's a three-legged guide or sine qua non that establishes whether or not you're disabled. I'm going to read that because I want to get it verbatim. Under the ADA, an individual with a disability is a person who, one, has a physical or mental impairment that substantially limits one or more major life activities, or two, has a record of such an impairment, or three, is regarded as having such an impairment. Now you notice they don't say diagnosed with, it's like regarded or who has it. A physical impairment is defined by the ADA, quote, any physiological disorder, condition, cosmetic disfigurement, or anatomical loss. So, I'm continuing from last time. My camera decided to go to sleep. And so what I was doing at that last time was I was talking about what a physical impairment is. And a physical impairment is defined by the ADA as, quote, any physiological disorder or condition, cosmetic disfigurement, or anatomical loss affecting one or more of the following body systems: neurological, musculoskeletal, special sense organs, respiratory including speech organs, cardiovascular, reproductive, digestive, genitourinary, hemic, lymphatic, and skin, and endocrine. Close quote. And some people think that the Americans with Disability Act has this long list of diseases or conditions that qualify you to be disabled. And to quote from the same source I just got that, it's impossible. There are just too many conditions to list that would cause one to qualify to be disabled. And remember that the three-part definition of who's a disabled person, or what is a disability actually, is a person who has a physical or mental impairment that substantially limits one or more major life activities, or two, has a record of such an impairment, or three, is regarded as having such an impairment. So what we're seeing from that is that there are people with disability who are disabled because of pain, chronic pain, and who may not be able to function properly without adequate pain management. So what we're doing is we're building up to trying to tie it all together at the end. Now, we've talked about physical impairment, we've talked about reasonable accommodation. We know that reasonable accommodation is a change to any job, work environment, or the way things are usually done that allows an individual with a disability to apply for a job, perform job functions, or enjoy equal access to benefits available to other individuals in the workplace. Now you might say, Doc, where are you going with all this? Well, where I'm going with all this is that I became aware of a nurse who had applied for a position with a hospice care company, and they offered the job to her. She accepted it. She had a test that revealed she had Vicodin in her system, which she's prescribed, which she's taken only one a day, which is less than the prescribed amount because she didn't want to take too much. And they were aware that she took Vicodin, and yet they quote-unquote rescinded their offer of a job. Now, I'm 60 years old, and I think I pretty well understand what being hired is. As an employer, I've hired several people in the last several years, and if I offer you a job and you accept it, at that point, you're hired. And you can't rescind, you have to terminate somebody's job. I know I've had to terminate my employees' positions before, and it's not fun, but if they're hired and you don't want them to work there anymore, you have to terminate them. You can't rescind a job after they've been working there or after they're officially hired. Now, I find that they would discriminate on someone with a disability about taking an opiate such as hydrocodone, Vicodin. Extremely deplorable, extremely hypocritical, And it's even more hypocritical because the majority of the people that are in hospice that they are making money off of, because this is not, as far as I know, this agency is not a non-profit organization. It's extremely ironic that the majority of the people that they are providing services to, they are getting their money from usually Medicare, I believe, as a result of taking care of these people that are on prescription medications such as Vicodin. I think it's very odd, very strange that they would, quote unquote, give a job, then take it away because they found out something that they had already been told, that the patient was taking Vicodin. And I think possibly it might be a legal issue because you're supposed to give the person reasonable accommodation if they have a disability. And having disc displacement is a disability if it causes the kind of pain that it interferes with major activities that can be dealt with proper, appropriate medical management, such as pain medications, such as hydrocodone in any of its forms, Vicodin, Norco, Lortab, etc. And personally, from my seeing patients who have different medications for painkillers, I don't think that tramadol is as effective as for back pain, neck pain, etc., as Vicodin, hydrocodone. And hydrocodone, I believe, is more effective than Neurontin and Lyrica, which are really for a different kind of pain than your run-of-the-mill extreme back pain. So what I think we have to do is start being realistic about Vicodin and the dangers. You know, they're trying to, in the news, they're trying to demonize Vicodin. Oh, it's an epidemic, you know, women are dying more than in car wrecks from abusing prescription drugs. If you look at the stats about people that die as a result of car wrecks or people that die as a result of domestic violence, you're going to see that a lot of people die from car wrecks and domestic violence, but we're not getting away with cars, trucks, buses, vans, etc. And number two, we're not eliminating folks getting married or cohabitating because there's a risk of domestic violence. Or we're not eliminating domestic partnerships. So it's kind of disingenuous, at the least, to start trying to demonize opiates because the allopathic medical industry hasn't really come up with a new class of painkillers that is going to be non-addictive and to replace the opiate class. So to sum up, we've seen that out of 11,000 post-operative people, only 3 to 4 showed signs of substance abuse. In the general population, only 8% have substance abuse problems, and there will be a subset of those who are addicted to opiates as opposed to heroin and other drugs. In our state, Texas, in Arizona, Arkansas, Louisiana, New Mexico, there's not a per se drug driving law, so it's not illegal to drive with Vicodin in your system. And it's also noted that people who are taking Vicodin, I keep saying Vicodin because it's a very common opiate, over an extended period of time, even high doses, who maintain a schedule of taking that drug appropriately, do not get the high, the disorientation, the consciousness alteration. Basically, they kind of settle into it managing their pain. So most people don't get addicted. Most people that are in car wrecks are not in car wrecks because they smoke marijuana or because they took a Vicodin. You know, there's a lot more people in car wrecks who are sleepy, supposed to be as bad or more or worse than drinking alcohol, alcoholism, texting. Those three things, or just being inattentive while you're tuning the radio or something, contribute to the deaths in car wrecks more than taking one Vicodin. In fact, I'm pretty good at scouring Google. I was an early adopter with Google and Gmail, and I couldn't find any wrecks that were caused just because there was one Vicodin in the system. But there's a lot of them that are caused by folks getting soused and getting on the road and weaving head on into another car. So we need to start treating Vicodin and other opiates for what they are. They're medications that have as their primary usage control of pain. And in Texas, dealing with controlled substances, the Intractable Pain Act says that doctors should not be afraid to give appropriate pain medication, even opiates, to folks who really need it, and for patients whom that medication is the proper medicine. So thank you for listening to my rant, even if I had to split it up into two parts. And if you know of a hospice agency that hires somebody and then says they rescind that hiring because they have a prescription drug in their system, and they told them beforehand it was in their system, and it's by prescription. If you know of such a place, personally, I can't tell you what to do, but as a doctor myself, if they're being that hypocritical about getting money from older folks who are in the majority taking opiates, but then they discriminate against someone with a disability for whom they should make a reasonable accommodation because they have prescribed opiate in their system sometimes. If they take one pill before going to bed and don't take it before they drive or before they go to work. In fact, this person probably is the most proper, most judicial use of a painkiller that I know of. So, thanks for listening to my rant. Be advised that there is discrimination against folks who are taking medications that are prescribed to them. And I think we should not in any way enrich these folks. We should not patronize or be a patron of theirs. And as a doctor, I personally wouldn't ever refer a patient to such a place. And if I were a doctor who was sending folks to hospice care, I would try to find out what their policy is toward patients using prescribed medications that they need to do their job or to function in life in general. They need to find out what that policy is, because if they're discriminating or finding fault with the employee taking a medication like that, are they also discriminating in the home setting because a patient who is terminal is taking that? It's a fair question and one that needs to be asked. So thanks for putting up with me. I hope you have a great day or night whenever you see this. Thanks for watching my channel. Bye-bye.